Today, we're doing a lower body lift. Our patient is from Northern California, and she's actually very young, but has managed to lose over 200 pounds of weight, right?
220.
220. And how much do we weigh now?
160.
160. So she's at a great weight, but has 220 pounds of tissue damage or skin damage. And what we are about to do is going to be transformational in a sense that body lifts, when they're done correctly, can have a huge impact. I did one yesterday and it was a redo of a circumferential tummy tuck, and honestly, so much of the work wasn't done that we redid the whole thing again, and we actually did it properly. So today we're going to do it properly. We're going to start with an incision low in the pubic area. It's so low that I can't even show you. It's about here. That's going to give her the pubic lift. This is the upper incision for the abdominoplasty. We'll be removing this much skin, which you may not appreciate how much it is, but look at that. All of that skin will hopefully be removed. We'll be lifting the front of her thighs like that, and we'll also be doing an outer thigh lift and a waist skin excision. So essentially removing all of this excess abdominal skin. As you can appreciate, her muscles have loosened up. So we'll be tightening her muscles starting up here all the way to the navel, and then from the navel all the way below. Like yesterday's patient, the navel is very low, but the difference is that this navel has a very long stalk, so I can actually pull it up as opposed to yesterday's one, which was already situated low, probably because of her anatomy or previous tummy tuck surgery. I'm not sure, but we couldn't really do much more, unfortunately, for our patient from yesterday, but nevertheless, we have to work with what we are given. On the sides, which way we're going to turn? Let's turn this way. On the sides, we're going to remove this much waist skin and this much outer thigh skin. And look how perfectly these incisions are planned. So this is all going to come and end up here. Here you go. We are at the end of our surgery, and just look at her amazing results. I ended up removing a ton of skin from her thighs. Her thighs were super loose, and I mean, look at that skin. So the thigh lift, the outer thigh lift and the thigh lift in the front worked perfectly for her. It was rather challenging because the amount of skin was staggering, but we managed to accommodate the skin excision and create a symmetrically placed incision and a beautiful, highly defined abdominal contour. And on the back, which is really half the surgery, we're going to be doing a significant buttock lift, removing, in this case, from the outer thighs about 7 to 8 inches of skin, and then narrowing that as we come towards the center, performing a buttock lift like that. I mean, look at that butt, it changes it completely. And utilizing this fat to augment the butt, and then we'll be liposuctioning a few areas and putting the fat into the lower buttocks and the dimple areas. So I plan to finish with a high definition body lift outcome, enhancing the projection of her buttocks, giving her a 3-dimensional improvement, not only removing the tissues, but using the excess tissue to actually enhance her buttock, creating curvature of the lower back, curvature of the flanks, and then a highly defined abdominal contour, which is 3-dimensional and sculpted. So we are now done with the back side of our lower body lift. We have performed buttock enhancement and a buttock lift with outer thigh lift. And I'm just look at her beautiful contour, perfectly and symmetrically placed incisions, buttock enhancement with lower back fat pad, what we call a flap because it has its own blood supply, and also liposuction fat. So this is a combination of fat that has been placed via a Brazilian butt lift and at the same time a flap. So double the augmentation as we are lifting the buttocks up and contouring her and removing fat from various areas. We use the fat to actually augment her buttocks, which is what she really wanted.